joining us today. I'm grateful to the leaders, the advocates, the constituents who have joined us today and know firsthand of the stakes of the government shutdown and its impact on the people of Boston and all across the state of Massachusetts. Dr. Bisola Oji Kutu is the executive director of the Boston Public Health Commission. Jeff Sternick is a lung cancer patient and a lung force hero advocate within the American Lung Association. Jeffrey Lee is a small business owner and a patient and board member of the Charles River Community Health Center. And Erica Johnson-Nabone is a small business owner. I'm going to begin just by laying out for you what is about to unfold for those three individuals. For Jeff Sternick, his yearly healthcare cost increase is going to go from $34,600 a year to $40,600 a year. That's a $6,000 increase. For Jeffrey Lee, it will go $8,400 increase from $3,600 a year to $12,000 a year. For Erica Johnson-Nabone, a small business owner in Westboro, $13,000 increase from $13,200 to $26,400 a year. That will be the increase that they are facing unless we block the repeal of the premium tax credit benefit, which they are receiving, and tens of thousands of people across the state of Massachusetts are receiving. Today, as open enrollment begins, 22 million Americans are in for a sticker shock. They are finding out that their health insurance will be dramatically more expensive next year. And why? Because the Trump and his MAGA supporters refuse to extend the enhanced premium tax credits that expire at the end of this year. So all they can afford to give that funding is to tax breaks for millionaires and billionaires in our country. While families gather around the kitchen table figuring out how to make ends meet, Donald Trump is refusing to come to the negotiating table. Democrats are fighting to make these premium tax cuts permanent, and Speaker Johnson and the Republicans are in a political witness protection program scattered around our country. They have not been in Washington for 5 weeks. The Republicans in the House of Representatives have taken a 5-week vacation from their responsibility to provide for the health care of Americans. That is what we're confronted with right now. We cannot in any way negotiate with people who are not in Washington, D.C. They have a job to do. They must do it. They are hiding from the American people so that they don't have to answer for the unjustifiable health care cuts that they want to make. Republicans have been dreaming and scheming to cut Americans' health care for a very long time. As a result of Trump's big, ugly bill, which he signed into law in July, over 320,000 Massachusetts residents could lose their health insurance coverage. That's almost 5% of the entire state's population. And now, if the enhanced premium tax credits expire at the end of this year, in just 2 months, 337,000 Massachusetts residents will see their health insurance costs skyrocket the way these three families are going to be impacted by those cuts. They have already received their notices of how high their rates are going to go. That's why we're here. It's a healthcare emergency. We're here at an emergency room at a hospital in Boston because we know that it's going to make it very difficult for people to continue to pay for the coverage for their health insurance. Because while these Republicans claim to be pro-business, they seem to have forgotten about Main Street. Nationwide, over 10 million small business owners and their employees enrolled in the ACA marketplace rely on premium tax credits to afford health insurance. In Massachusetts, we have approximately 700,000 small businesses. One small business for every 10 people in the Commonwealth. And many of them, thousands of them, are going to see a dramatic increase in their health insurance costs for themselves and for their workers. In Massachusetts, people who are self-employed, like Jeffrey Lee here, make up a quarter of those who are going to lose their tax credits. They simply don't have thousands of dollars socked away to cover for those soaring premiums. One couple in Worcester County, who are both self-employed, are seeing their out-of-pocket costs almost double for their family of four to over $2,500 per month. But you can multiply that by 12, so it's closer to $30,000. That is what this entire crisis is going to be like on a yearly basis. It's forcing one of them to close her own business and find a job that offers health insurance. Working people and retired folks who don't yet qualify for Medicare are also being hurt. A 62-year-old in South Hadley is seeing her health care costs triple. She is being forced to take Social Security payments earlier than she planned. Another couple in their early 60s are also facing premiums of $2,200 a month, more than 4 times what they owed last year. They're now planning to go without insurance until they qualify for Medicare and are hoping they won't have a health care crisis before them. The stories from across the Commonwealth are heartbreaking. We're hearing them from community after community in story after story. You're going to hear some of those stories right here today. You're going to hear their stories, and then you can multiply them by 337,000 people in the state of Massachusetts who are getting these premium increases in the mail right now. And it's going to dramatically impact their ability to be able to deal with their crisis. This is not chump change. The decisions Trump and MAGA Republicans are forcing people to make are unconscionable. The Republicans right now are engaging in a healthcare shutdown of our government. They refuse to come to Washington to negotiate over an end of this shutdown and to provide the healthcare benefits which people need in order to give them the access to the healthcare which they need for their families. That is what we are talking about every single day. And finally, yesterday, judges ordered the administration to finally release $6 billion in contingency funds to pay for SNAP benefits for November, beginning today. And it should not have come to this. The president shouldn't have to be ordered to keep families from going hungry. The 1.1 million people in Massachusetts, out of 7 million residents, 1.1 million people, 1 in 7 residents of Massachusetts are on SNAP benefits for the food they provide for their families. Those people should not have to wonder whether or not they're going to have the funding in order to provide that food for their families. The cruelty is the point in the Trump America. The White House gets a new gold ballroom, and Argentina gets a $40 billion bailout. In Malden, where I live, in Malden, the Stop and Shop is selling a gallon of milk for $4.29 right now. A SNAP beneficiary gets $6 a day for food. That's it. It's $4.29 for a half gallon of milk in Malden right now. That is absolutely unconscionable. that they are not going to provide the funding for that family. So that's where we are. As the great Ralph Waldo Emerson once said, health is the first wealth. That's what we're fighting here today, to make sure that these healthcare premiums don't skyrocket, to make sure that food is put on the table of Massachusetts residents, and we're here today to raise our voices to make sure that those protections are given to everyone. So let me first introduce Dr. Ochi Kutu, who is the Executive Director of the Boston Public Health Commission. Welcome, Doctor.
Good morning, everyone. My name is Dr. Bisola Ochi-Kutu. I'm the Commissioner of Public Health for the City of Boston. First, I want to thank Senator Markey for your leadership and your strength at this very crucial moment, at this very difficult time. You know, it's leaders like you who are so incredibly important to the work that's happening and to how our residents are going to be able to make it through this difficult time. And then to also thank the entire Massachusetts federal delegation for fighting in D.C. to protect our communities here in Boston and beyond. I also want to thank Mayor Root and the Boston City Council, who can't be here today, for their leadership to help provide clarity to our residents at this time when the administration is doing nothing but sowing chaos and confusion and undermining long-standing efforts to prioritize health and wellness. You know, health insurance is our most powerful tool that we have to ensure our residents have access to primary care, emergency care, and care and treatment for chronic diseases. Massachusetts has long led the nation in the expansion of affordable health insurance coverage. It's one of the many admirable things that Massachusetts is known for. And because of this state's efforts, the vast majority of Bostonians, 97%, are actually insured. So what does that mean? 97% of Bostonians know that they can seek medical attention without the fear of catastrophic financial costs. At this time, 97% of Bostonians know they have access to regular checkups to detect cancer and heart disease so they can live long and well. And 97% of Bostonian families have kids that can access vaccines, which we strongly promote, dental and vision care, primary care prior to starting the school year. In short, health insurance is peace of mind. Federal decisions to increase health insurance premiums, limit insurance eligibility, and decrease funding are threatening our peace of mind and our right to health care nationally and in this city. Despite the barriers that have been created and the confusion that has been sowed by this administration, we want our residents to access health insurance and remain enrolled. So we urge you to take advantage of the options available in Massachusetts and to maintain your coverage. So you can do this by reaching out to the Massachusetts Health Connector Marketplace during open enrollment, which, as the Senator said, starts today and lasts throughout January 23rd of next year. I have to say that as a doctor, I'm an infectious disease doctor, I work at Mass General Brigham, I have an office in this building. Sometimes health insurance is just complicated. And for those in Boston and for others, we have a wonderful resource that I want you to access. It's called the Mayor's Helpline. The Mayor's Helpline is free, it's confidential, it's a multilingual health information and referral service. And in light of all these federal changes, the Mayor's Helpline services can provide case management to help residents maintain health insurance coverage. We also have Shine counselors who can help people with Medicare coverage. Our staff are partnering with Boston's Age Strong Commission to hold more than 20 Medicare open enrollment events through the Mayor's Helpline across the city. I want to mention that we have many different staff members who speak Spanish, Haitian Creole, Cape Verdean Creole, and Portuguese. So please call the Mayor's Helpline at 617-534-5050 or email mayorshelpline@bphc.org if you need help. And in the midst of these federal threats, at the Boston Public Health Commission, we are really strengthening our resources. We're putting more staff online, we're putting more resources into the Mayor's Helpline, and we're partnering with all of the community health-based organizations and stakeholders here in Boston and beyond to mitigate the impacts of these changes. Lastly, I think it's important to emphasize today that when individuals lose health insurance coverage, we all pay the price. People who don't have health insurance are likely to skip preventative care, worsening outcomes from preventable diseases like diabetes, heart disease, and many forms of cancer. And they'll utilize more healthcare resources. Healthcare providers will become less available for everyone, community health centers will suffer, and we will have increased emergency calls to Boston EMS. Wait times will increase, and we as a city and across our state will experience poor health outcomes. But regardless of this administration's reckless and irresponsible actions, we here in Boston and across our state stand with you. We stand with patients, we stand with residents, and we stand with our communities. We won't stop fighting to ensure that you have access to the coverage that you need so that you can be healthy and well. Thank you.
Thank you, Doctor. Next, we're going to hear from Jeff Sternick, who is from the Lung Force as a hero advocate and representing the American Lung Institute.
Hi, I'm Jeff Sternick. I am a lung cancer patient. Before I was a lung cancer patient, I was just an ordinary Jeff like every other Massachusetts resident. Luckily, I live in Massachusetts, and when I got sick, there were great options, and they kept me going. I had a great job and people. So one day, when I lost my job, when I lost my work-sponsored health care, I found myself in quite a bind. I went shopping for private health insurance, and the companies across the state were quoting me numbers like $15,000 to $20,000 a month for coverage. I panicked. I had no idea what I was going to do. And then luckily somebody said, hey, you need to contact the Health Connect, which I did. And I found coverage that I could afford. And I was able to continue going to all my doctor's appointments and taking the medicine that I take. The medicine I take is $26,000 a month. So I'm happy with the Pfizer company. I wish they could bring the price down a little bit. I don't have to pay $26,000 a month because of my insurance. I just 2 days ago got my renewal notice from Health Connect, and my medical expenses, deductibles, and co-pays. I'm lucky. I worked for a long time and I was always a good saver. But for a lot of the people in the community, if they suddenly lost their job and lost their health insurance and they look to the connector, they may not be able to cover the incredibly, like even the connector is expensive. The great thing about it is it provides access to everybody. But without the subsidies that are in place for some people, it would be prohibitively expensive as well. So it's important for people to remember how many people in the community depend on affordable health care and how important it is to all of us. Thanks.
Beautiful. Great job. Thank you so much. And again, for Jeff, his coverage is now going from $34,800 a year to $40,800 a year, $6,000 increase. People who qualify for this are not millionaires. They don't make $1 million a year. They don't make $250,000 a year. They don't make $150,000 a year. These are just regular people.
We don't have jobs.
Huh?
We don't have jobs.
Jeff does not have a job, and his health care is going up by $6,000 a year. That's the story. Next, we're going to hear from Jeffrey Lee, who is a small business owner and a patient and a board member at the Charles River Community Health Center. Welcome.
Thank you. Good morning. I want to thank Senator Markey for allowing us to speak today. My name is Jeffrey Lee. I'm a resident of Newton, Mass, and a true single father to two teenage daughters. My older daughter is a sophomore at UMass Amherst. My younger daughter is a junior at Newton South. I'm here to speak today not just on behalf of my family, but many families here in Massachusetts that benefit from the Health Connector and from our health care. I cannot fathom or imagine what it would be like if so many families would be impacted by having such a huge increase in health care. Unfortunately, I had the misfortune of losing my wife to cancer in 2017. She was the healthiest person I knew, and after a year and a day after diagnosis, she passed away in a building that's a couple blocks from here. So I lived firsthand, and I know the importance of healthcare and how that can impact a family. This is not about politics. This is about families. This is something that is, it doesn't matter what side of the fence you're on, that we desperately need for all of us, and especially for someone who is a single parent like myself. When there's only one income to the family, having your healthcare increase by double or triple, it's unfathomable. And that's why I'm here to speak today. Not just for myself and my two daughters, but for so many families that need this. It's not a benefit, it's a must for the struggling families and for the working families that are residents of here in Massachusetts, and I'm sure around the nation. Thank you.
Beautiful. Thank you, Jeffrey. And again, for Jeffrey, right now, his health insurance costs $3,600 a year. It's going to go to $12,000 a year. It's an $8,400 increase for Jeffrey. And again, you're not wealthy if you qualify to be in the connector. It's a very limited income which you can have, and the same as Jeffrey, it is absolutely going to be catastrophic for their family. And next we're going to hear from Erica Johnson Narbonne, who is a small business owner. Welcome.
Good morning. I want to thank Senator Markey for having us here to speak this morning. I am a physical therapist and a small physical therapy practice owner. My practice is in Westboro. And my husband and I, who he is also a local small business owner, purchase health insurance through the Health Connector program because this is the most affordable way to obtain health insurance for small businesses in the state. In the fall of 2024, we were notified by Boston Children's Hospital that they and our beloved pediatrician would no longer accept the insurance that we were using through the Health Connector. During further research, we discovered that several other providers whom we trusted were also dropping our coverage. We researched other plans under the Health Connector and found a policy that was accepted by the Boston Children's Hospital and our other providers. This resulted in our insurance premiums increasing over $1,000 a month in 2025. This was an increase of over $13,000 just for premiums. Forget the rest of the medical expenses that quickly add up when you have high deductibles under these plans. This increase resulted in our insurance monthly payment for our healthy family being more than the cost of our mortgage. Recently, we've been notified by the Health Connector and have heard through national news that the premiums are going to go up in 2026 significantly. This continued increase will limit our ability to grow our businesses that support our communities and provide resources for our family. We don't have any new information for what our planned full increases will be this year because it was just released this morning, but we worry about other families like ours and other community members that are going to be struggling with the same struggles. Thank you so much.
Beautiful. Thank you. Thank you. And again, for Erica, she's a small business owner in Westboro. For Erica, she is going to see her healthcare premium increase from $13,200 a year to $26,400 a year, an increase of $13,000. And again, this is a small business, not a big business. It is absolutely going to be catastrophic for her and for families like hers across the Commonwealth. It's hundreds of thousands of people who we're talking about in Massachusetts who are receiving the notices right now about these dramatic healthcare premium increases. So let me stop here and answer any questions which you may have. So, yes, sir.
What's your reaction about the Supreme
um, the Federal District Court in Massachusetts made the right decision. Trump has an obligation to use the $6 billion in contingency funds to ensure that people are able to put food on their table across Massachusetts and across the country. Trump now has a legal obligation to ensure that the hungriest in our state and our country get the funding they need to put food on their tables. All that a SNAP beneficiary receives is $6 a day to provide food for their families. The court has ordered Donald Trump to provide that funding, to not allow it to be cut off. It is inhumane to even think that in the wealthiest country in the world, where we do not have a food shortage, that there is even a day that we would not provide people with $6 to provide for the food for their families. And again, in Malden, it is $6. In Malden right now, it's $4.29 for a gallon of milk. And all that person will receive is $6. So it is absolutely irresponsible, unconscionable that that funding is not going to be made available. Trump should comply with the federal court order from the Boston Federal District Court judge and ensure that funding flows. He has $6 billion in order to make sure that people have the funding they need for the food for their families.
Senator, how confident are you that the administration will comply with that order, and is there any action that can be taken if it doesn't?
President Trump could have already provided that funding. It is there. The contingency fund of $6 billion for food for people who receive SNAP benefits has already been there. Trump has been unwilling to use that funding. The Federal District Court from Boston has now ordered Trump to use that funding. He says that he is going to comply, but I await his compliance with that order because families need that funding right now to provide for the food that they need on their kitchen table.
Obviously, a lot of frustration with the stage of the shutdown, and I now what can you do to get Republicans to start negotiating?
The House Republicans have been on vacation for 5 weeks. They refuse to come back to Washington. They're in a political witness protection program. They're hiding around the country. We need them to come back to Washington to sit down at the table so we can negotiate the resolution of this issue. We can do it with one vote. We can reopen the government and provide the health care benefits for all of these families, and we can do it in one vote. We can do it next week. But we need the Republicans to return to Washington because across the country there are tens of millions of people like this who are receiving their skyrocketing health care bill increases right now.
Are there any courses of action you can take if they continue to not return?
No. We need the Republicans to return. We need Donald Trump to go to the negotiating table to provide the protections for the health care for all of these families. They're by the millions right now receiving notices of health care premium increases that are going to lead to desperation, unfortunately, in too many families across the country.
If Trump doesn't give those funds away, the court's ordered him to do, can he be held in contempt by the courts because he doesn't do it? Or it's really just...
If Trump does not provide for the funding for the food for families in our country, he will be in violation of the law. He will be in violation of a court order that instructed him to provide this food for the hungriest in our nation.